Hello everyone, welcome to Centralia Elementary School District's Wellness Wednesday Parent Workshop. Our goal is to promote health and mental wellness. I am Dr. Stacy Chang, Director of Parent and Student Engagement at Centralia Elementary School District, and today I am here with our district social worker, Karen Liao. When we think of wellness, we think of physical health as well as mental wellness and social emotional learning. For physical health, we are going to be talking about COVID-19 health and information. And then for mental wellness and social emotional learning, Karen Liao will be presenting information on SEL. Many people also refer to spiritual wellness. Today, we will focus on our physical health as well as mental wellness. COVID-19 parent trainings are part of the attestation requirement to reopen schools. We will be training all staff, providing educational materials to families in the following safety actions: enhanced sanitation practices, physical distancing guidelines and their importance, proper use, removal, and washing of face coverings, screening practices, how COVID-19 is spread, and COVID-19 specific symptom identification, and preventing the spread of COVID-19 if you are sick, including the importance of not coming to work or school if someone has symptoms or if someone they live with has been diagnosed with COVID-19. We will be addressing many of the items that are listed here for you, and we will have additional upcoming parent trainings and educational materials for more information. Today, I would like to provide a COVID-19 training and overview of the 7 prevention pearls. This is from UCI Professor of Infectious Diseases, and it is used with permissions from UCI, and we have edited parts of it with CESD health protocols. Prevention pearl number 1 is using multiple barriers. Multiple prevention barriers are necessary in order to decrease the chances of COVID transmission. By multiple prevention barriers, we are referring to universal masking, hand hygiene, cleaning, physical distancing, daily symptom and temperature screening, and staying home when ill. By utilizing multiple prevention barriers, then we are decreasing the likelihood of COVID transmission. Prevention pearl number 2 is address droplet spray. One of the 2 ways that we have learned that COVID is transmitted is through respiratory spray from ill person to your eyes, nose, or mouth. Many refer to that as the T zone, because you can spell out T with your eyes, nose, and mouth. Universal masking is protective, and you must cover your nose and your mouth when you are using a mask or a face covering for those purposes. Prevention pearl number 3 is addressing the hands. One of 2 ways COVID is transmitted is through the surfaces. Infected droplets on surfaces can survive up to 1 to 2 days, and some research is showing that it can even be longer depending on the surface. But you can safely touch infected surfaces if you perform hand hygiene before and after touching your face. So if you're rubbing your eyes, scratching your nose, adjusting the mask or glasses, make sure that your hands are clean. Sanitizing or washing hands frequently is a key in the prevention of COVID-19 because of these reasons. Prevention pearl number 4 is high-touch objects. Environmental contamination, formal cleaning crew at the end of the day, and in between time, cleaning high-touch classroom items throughout the day, disinfectant spray and paper towels being available and being utilized, and avoiding sharing objects. And of course, if there are objects that need to be shared, then you need to have a plan in place to clean or disinfect in between the uses. And as part of our reopening plan and safe and health protocols, we have plans in place to do just that. Knowing that the research calls for this and the guidance calls for this, we have our former cleaning crew who goes through the campuses and cleans with a deeper cleaning method than we have utilized in the past. And our frequently touched areas are actually cleaned throughout the day. Prevention pearl number 5 is eating. Eating is actually considered a high-risk moment. That's because the mask comes off and you can be near other people. So it's important to keep your hands clean. Make sure you're cleaning, washing your hands, sanitizing your hands before unmasking, before you're eating. And make sure you have clean bags for mask storage. And so if you want to have a Ziploc bag or a clean bag for your masks, that is a great idea and is recommended. Centralia School District is looking into alternative options so that our students can have convenient bags for mask storage. We want to make sure that students and staff are keeping their distance while they are eating so that they can stay safe, and ensuring that there is no shared food. Prevention pearl number 6 is speak up. Symptom and temperature screenings are important so that you are aware of your own or your children's symptoms and temperature screenings. You should not be coming to school or work when you are ill, and mild symptoms do matter. We're learning that the most infectious period is early on of the disease, and so it's important that if you have any symptoms that you do stay at home. We have a plan to send staff or students home even for mild illnesses. And so we have the mild to moderate symptoms listed for you. As you may be aware, this list has been growing since we have been learning about the pandemic. Mild to moderate symptoms can include fever, cough, shortness of breath, chills, repeated shaking with chills, muscle pain, headache, sore throat, new loss of taste or smell. And then we learned of the emergency warning signs. We want to make sure that you contact your medical provider immediately if you have any of these signs. Trouble breathing, persistent pain or pressure in the chest, new confusion or bluish lips or face. The researchers and medical providers are saying that these are emergency warning signs. Pearl number 7, quarantine planning. If a family member tests positive for COVID-19, the whole house would have to quarantine for 14 days. If a student or a teacher of a class tests positive, the whole class may end up being in quarantine, and that will be under the direction of the Orange County Healthcare Agency. Middle school and high schoolers may end up quarantining in multiple classes since they go through different periods throughout the day. At any one time, there could be some healthy students in quarantine, some healthy teachers in quarantine, and that's why it's important to have a contingency plan for remote learning. And we have that in our reopening plan. If there is a chance of a positive case, then we will work directly with the Orange County Healthcare Agency's school response team, and under their direction, we may have to transition to distance learning during the time of the quarantine. And of course, if anything like this happens, we would communicate this with the community members. For COVID-19 trainings, educational materials, and videos, you will be able to find these on our district website, our Peach Jar, as well as our social media accounts. Principals are holding additional site-specific meetings to share the plans that they have in place for their school's safe and health protocols. There are lots of details that our team members have thought through, utilizing the guidance from California Department of Public Health as well as Orange County Healthcare Agency. And we want to ensure that our parents who have selected in-person learning for their students know that we have multiple barriers, multiple layers of protection that are in place for our students and our staff so that we can do our best in preventing COVID-19 spread. We know this is not the easiest times, and this is a personal decision that families are making during this time to decide if they will be sending their students to in-person learning. But we want to ensure our families that we really have thought through the details utilizing the guidance, and that we have a strong plan for our students and families. Thank you. Next, we want to transition to our social emotional wellness, promoting your child's emotional growth at home. And Karen Liao, our district social worker, will be sharing this information.
Thank you. I'm so glad to be here, and I'm so glad to be connecting with parents and caregivers. I know we're using the word parents very casually, but we also recognize that we have caregivers, and there's people out there that are taking on the role as parents, and there's different variations to our family. So we want to acknowledge that and know that we're inclusive of everyone in that aspect. So again, thank you for joining us. Next slide. Okay. So one thing that I just want to take a moment and see if we can all really just think about, you know, down the line, 10 years from now, 20 years from now, really think as far as what are those hopes, what are your dreams for your children, what future do you see for them? So if we can just take a moment and think about that and really just envision what is it that you hope to, that your children are accomplishing 10 to 20 years from now. So just really envision that. Close your eyes, or just if you want to think for a moment as far as adults, what are they going to look like? What is their life going to look like? What are they going to, where are they going to be in 10, 20 years from now? All right, we're going to come back to that in a few slides, but really I want you to think about that and really carry that, because that's really going to guide why we're here and why we're discussing the things that we're discussing today. Next slide. So here at Centralia School District, we're very much committed to the education and learning of all students, and recognize that they all have diverse educational needs. And so we're here to rise up to the challenge and address them. But not only are we concerned with them in elementary and their learning, we're really looking at how are we equipping them? How are we preparing them? How are we supporting them? Because they will transition to junior high, to high school. And we hope that they're going to be moving on to college and university. And we're really just invested into creating opportunities that they will be able to be lifelong learners. And so those are things that really guide our principles, really guide our priorities, and really guide as far as what are the agendas and things that we want to discuss. Next slide. So what better opportunity now to kind of discuss, you know, how are we supporting our students? How are we supporting our families? You know, Dr. Chang mentioned some of those obstacles, and definitely living in a global pandemic is something that has changed the lives for many of us and for our children. Hence, you know, school looks different. And as we prepare and we start planning for our students to return to campus, it will look different. So while it could be challenging, and there could be struggles, and there could be stressors, and definitely, you know, families are impacted in so many different ways by this. There's also, in light of all these obstacles, there is a great opportunity for us to really support our children in developing new skills and developing new capacities. And really then the discussion comes from how can we support our children and our students in overcoming obstacles and overcoming adversities. And so that's kind of the theme of today is, you know, how can we instill that in our children? So today we're going to be going over, just in general terms, how you can set that stage at home and be there for your children and promote in their growth. And I know that this is something that a lot of parents might have questions on. You know, they're not having the opportunity to interact socially. There's a lot of distancing or having to do things at home, and so that's really limited their interactions. But there are opportunities to support that growth and promote, and like I said, there's an opportunity for new capacities. So we'll be discussing, most importantly, parents, caregivers, how you guys are able to support in that. And a big piece of that is doing self-care and making sure that you guys are in the right headspace, that you guys are feeling supported. And then also we'll be talking a lot about what the science says about resiliency, and that goes along with the theme as far as overcoming the obstacles and challenges. Next slide. So as I mentioned before, we're all being impacted by this global pandemic. And so there's lots of challenges that we might be all facing. But when we talk about being able to promote social emotional growth in children, it really is important to talk about our emotional growth and our emotional well-being. And I think we can't say this enough, we're all being impacted by this. But what I really want you to just consider is think of the emotional growth or your child's development. Imagine a house. And so we're imagining a house. It's really important that in order for a house to be strong, we have to make sure that that foundation is strong, it's secure, and it can hold up the walls, it can hold up the ceilings, and then you can talk about, let's paint the walls, let's put some curtains on. And so really the parents, the caregivers, we're that foundation. And so in order to be able to teach our children to model or encourage their social emotional growth, we just have to have a strong foundation for ourselves and be that for our families. Next slide. So how you can do that is making sure that you have the energy, the stamina. You know, there's a lot of things going on, but we really need to take that time to take care of ourselves so that we can take care of others. So really, you know, doing movements, physical activity. So going for a walk is something that can be really helpful as far as replenishing your energy. And again, being able to be there for your children socially and emotionally, savoring a cup of coffee and just really enjoying, you know, the smell, the temperature, the taste, and just really being in the moment of drinking your coffee, talking to friends, talking to other parents that might be sharing similar struggles or similar challenges. It's really important that we find those opportunities to connect. Again, we're looking for creative ways because maybe it's not something that, you know, we can't do our family parties or our family get-togethers, but trying to be creative as far as how we can maintain those connections in different ways. Other things, I know some of us are also working from home and also trying to navigate distance learning and still trying to do all the day-to-day parenting, but really just taking those moments, even if it's just a few deep breaths before hopping on into the next Zoom meeting, just making sure that you guys are in a place that you're replenishing your energy is very important. And these strategies are actually by UCLA Health. And so these are science, this is research-based that for people to feel less stressed, to feel in good spirits, to feel in good moods. There's evidence that all of these things are helpful in that aspect. Next slide. So again, considering that this is a very challenging situation, it's a situation that I would think most of us, if not all of us, have never really been through, have never experienced. So another thing or a good mindset to have is that things are not going to be perfect. There's a lot of imperfection. And so maybe this is not the time that we want to tackle on big projects or really challenge ourselves because there's just so much going on. So we really want to be gentle with ourselves and just really give permission that, you know, things are not going to be perfect. And I know that there's a lot of information out there, like this is how you create schedules and make sure that your kids are eating healthy and make sure that they're getting exercise and make sure. And so there's countless of things that we are now trying to focus on and be responsible for. But at the same time, we have to recognize we are limited. We are limited in time. We're limited maybe in space. We're limited with our outside surroundings. You know, there's, of course, we want our kids to be outside and getting exercise, but now we have, you know, fires going on. And so that has limited our day to day. And so just being able to, you know, give permission that, you know, maybe every day is not going to be perfect. Maybe not all day is going to be perfect, and just being okay and giving yourself permission. Next slide. Another thing, the science and research really speaks to the fact that people that have less stress, that are happy, that are content, are really people that can practice that compassion. And when we talk about compassion, it's having that compassion for yourself. And we touched a little bit on not expecting perfection, you know, being gentle as far as, you know, we're all going to make mistakes. We're not always going to be at performing at 100%. And so having that compassion for yourself, but also having that compassion for others. You know, there's other people out there that might be struggling. And so having that compassion or that ability really helps people in decreasing their stress or being able to have that optimistic outlook. And so those are really important and significant things. And then also, that in turns is having compassion for our children, right? And so, you know, we might be seeing our children are experiencing stress in different ways. Maybe they might be regressing a little bit, or maybe things that they used to do really well before, not so much, they might be a little bit more clingy. And so just having that compassion or that awareness is we're all kind of reacting to something that's very abnormal, very, you know, never would have predicted that we would find ourselves in this situation. And so, you know, these reactions might be normal and healthy. And, you know, that's just a way of reacting to something that's way out of the norm. Next slide. So now we can talk about as far as how can we support our kids and what is it that we hope for them to be able to accomplish. And when we talk about those capacities, what are those opportunities for growth? And the biggest thing is resiliency. Resiliency really speaks to the children's ability to thrive or bounce back from a stressful situation. And it talks about and it also, according to Chalk's Children's Hospital, they also talk about how resiliency is something that we can instill, that we can teach, and that we can show and model for our children. So it's really significant. So now I want you to think back as far as those hopes and those dreams that you have for your children in the beginning of the presentation that I asked you to think of. You know, maybe for some of you, you thought of professionals. You know, I want my son to be a doctor. I want my son to be a teacher. I want my daughter to be a good mom and to have good kids and to have kids of her own or a family of her own. So think about how, you know, in order to get there, our children are going to be going through obstacles, adversity. It's not going to be easy. And so this is something that is so important now to help them manage the current challenges or situation, or it's also helpful to help them be good students now, but this is something that's going to carry them on as they transition to junior high, high school, or as they transition into their lives or their adulthood. And so this is something that's very important and significant. And again, this is what science says, you know, children that are good students, children that are successful are children that have this resiliency component. I also want to share, you know, when I think of resiliency, I also think of, or adversities and how those are those opportunities that our children can thrive or develop those new capacities. It makes me think of a particular situation where I had a teacher a few years back confide in me. And she talked about how her older daughter had just moved to college. And that's great, right? But she was sharing that her younger daughter was very sad and she was crying and she talked about missing her older sister a lot. And so as parents, I know we want to protect them and we don't want our children to be sad. We don't want them to be experiencing negative feelings and negative thoughts. We want them to always be happy, to be elated. But when she shared this shared this with me, the first thing I thought of was, wow, that really speaks to the bond and the relationship that the younger daughter and the older daughter had. And so it really speaks to the family values that the family has, and how, as a mom, she was instilling that in her children and in her daughters. So what a great opportunity to just really, it became about how can they connect, but in different ways. How can they sustain that relationship and make that strong, even though they're in different states. So it was being really proactive as far as scheduling phone calls or scheduling meetings, or, when she did come back into town, it's very strategic as far as, this is the day I'm going to spend with my sister. And so again, I just really want to think about all those adversities, how there is just an opportunity to grow, to develop. And, not all adversity is can be challenging, but there's just a lot of growth and opportunities. I don't want to minimize. I know that some families or some children might be going through a lot greater adversities that may be too much or may be harder to handle. And so just know that there is resources, there's information, and there's guidance, and there's counseling, and there's programs to help support parents and to help support children now. And even during this situation, those resources are available. And towards the end, I'll be sharing a little bit more as far as how you can access that or where that information might be available for you. Next slide. So what does science say for why do we want our children to be resilient? We talked a little bit how that's going to help us with their future and their accomplishments. But what science says is that children that have resiliency tend to be happier. So, and they're in better spirits, they're in better moods, they're more likely to be motivated and engaged. And again, think about, just for a student learner, those are very critical components to be able to have in order to learn and be good students. And they're also more likely to have a positive attitude. And so instead of looking at a situation very difficult, they're likely to overcome it and work through it. Whereas someone that may not have resiliency might be, this is just too hard, I'm going to give up, I don't want to do this. They might have that avoidance, and so they may not even try. And so that's why resiliency is so important in children. Next slide. So when we talk about resiliency, what we're really talking about is the ability to do certain things, or the ability to have this and to demonstrate these abilities, right? So the first is the ability to identify emotions. And so that sounds simple, but it's really not, especially for our children, especially children that are developing language, that are developing the ability to think more analytically or more advanced, especially elementary school age children. They're not all there yet. So they're developing these skills and also trying to understand feelings. Another thing that elementary school age children may struggle with is just, even aside the concept of being able to say, I am sad, I am angry, the concepts that a lot of times we can have mixed feelings or two feelings at the same time. So we could be jealous that, maybe our friend got selected for a team and we didn't, but we can also be sad or fresh, but we can also be happy for that friend. And so those things can be very confusing, especially for elementary school age children. And so one of the biggest things that we can help and support them is how they can label those feelings and talk about those feelings. The other component is the ability to regulate emotions. So, not letting the feeling get so big, again, that stops them from doing things or enables them from doing things, or they get stuck in those feelings. So, not letting the anger get the best of you, or not getting jealousy get the best of you, or being able to impact that friendship. So that's a huge ability that we want our kids to learn. The other ability is the coping skills, right? So we all have feelings. That's normal, that's natural. We don't want to tell our kids, oh, get over it, or it's no big deal. But what we want to do is help them manage those feelings in the way that, you know, that anger is not going to get the best of them, or how can they make that anger smaller, or how can they work through that anger so they can get onto the other side. So that's what we talk about, like coping skills. Another ability for kids that have resiliency that they're able to do is practice that mindfulness. And mindfulness is something that's so, can be so beneficial and so helpful. The mindfulness really serves students or children or even adults a way to kind of not get stuck in those negative feelings, not get stuck in those negative thoughts, in a way to kind of get out of them. So it's kind of letting, you know, get out of that headspace. And so that mindfulness really talks about just being aware of surroundings, or being able to do things outside, again, out of your headspace, to be able to overcome those obstacles or those negative experiences. And I'll share a little examples as far as what that looks like. Another big thing for resiliency, and this is science, research says that children that are resilient are able to express and demonstrate gratitude. And that helps in so many different ways. It helps with empathy. It helps with being good friends. It helps with being good children, or just good citizens. But it also has a fulfilling energy, and so it actually fuels people. So especially when you are going through stress or you're upset, the ability to express gratitude and demonstrate it is just can be very healing and very helpful. And so these are the skills that we want to try to help instill in students and children so that they can master that, what we call resiliency. Next slide. So as parents, how can we encourage that? How can we promote that? How can we teach them? Because it is a lot. But one of the most simple or basic ways that you can do that is through books. A lot of times books are great examples, and they have great characters that can demonstrate how to manage those emotions, how to deal with anxiety, how to overcome anxiety, overcome adversities, especially if it's about characters that are going through challenges and they are, you know, they come out on the other side and they do well for themselves. It's also the ability for a child, through books, through movies, they can take perspectives of others. And so that's so important when we talk about empathy and just being aware of others. And then a great opportunity to, again, identify those emotions. So you can talk about those characters, you can have discussions about them. You know, why do you think she felt that way? Why did she do that? So those are all just great discussions and ways for students to be able to practice these skills and really master them. Next slide. So here I just compiled a list. Common Sense Media is a great website for families, for parents, and they have countless list of information, and they have specific books that are meant to inspire gratefulness, self-esteem, but they even have discussions as far as apps, movies, games, TV shows that really promote strengths and skills in children. And they even have it divided by age group. So if you have something that you're looking for teens, or something that you're looking for preschool or elementary, it's a great information. And so these are links, and then we'll make sure that you're able to access this information if that's something that you are interested in. It also even has things based on language or ethnicity or culture. So it's a great resource for families and parents. Next slide. So some ideas for calming activities that you can do when we talk about like helping our kids get out of that mindset, or when they're feeling frustrated or anxious or angry. These are things that will help them overcome those emotions. One thing that I advise is these are things that we want to practice with our children when they're calm. So maybe not when they're in that being overly angry or frustrated, because these are things that might be new to them. And so these are things that we have to teach them and they have to learn. And so if they're very excited or, you know, very upset, they may not be in the headspace, one, to try something new, or two, to learn something new. But these are things that you can do every day or day to day and just practice. Again, for calming, for mindfulness, are all things that, you know, it's really takes practice, and it's a process. It's not like we do it one time and then, you know, we have it down. And so it's kind of like, you know, with health, we want to make sure that we're eating, you know, healthy every day, or we're exercising. It's the same concept as, you know, we have to practice these things and have it be part of our routines. So deep breathing, relaxation, that is huge. Oxygen. Science says that we need that oxygen. And when we're upset, when we're in that state of you know, not being able to calm down, really what's going to help the brain, and it's going to help our levels, is to really bring that oxygen in and that relaxation. So that is significant. And again, there's so many different, there's YouTube videos and ideas out there to really help kids on how to practice that deep breathing. Another thing that's huge is chewing gum. And as parents, you might think, okay, it's like candy or it's a treat, but really that motion of activity and doing things, again, really helps with getting out of that headspace. And also think of the flavor. Also think of just like the mechanics of chewing. And so that really helps, again, to take out of that headspace or out of that mindset to be able to chew gum. Another thing that's really helpful with children in calming is Play-Doh. And Play-Doh is really, again, about being able to sense how the Play-Doh feels, the temperature, the coolness, the texture of it, right? It's kind of slimy, the smell. And so those are, and even just the color, right? If it's bright purple or bright pink, all those things are going to get kids away from that headspace or being frustrated or overwhelmed. These are just ways to kind of help kids get out of those loops or out of the cycles, out of their headspace. Music is also a great thing. It helps with mood, helps with movement if they dance, especially if it's something upbeat or positive. Fidget toys, so those a lot of fidget toys involve like texture, like rough things or prickly things or smooth things, so those are really helpful. Stress balls, again, being able to move your muscles, it helps in so many different ways, but that movement really helps. Bubbles is also another amazing thing. It's amazing in the sense of it helps children with the breathing, because you have to breathe in to be able to breathe out. It helps them visually, because it's that glistening or that the way it reflects light. It can help with movement if they get excited and they want to run and pop the bubbles. So those are really great ways, especially for elementary school children, to really be able to calm down or just practice that relaxation. Another great thing is a pinwheel. So those pinwheels that you blow, so there you have the oxygen, the breathing, but also the visual stimulation of the colors and the movement are very big things that can be very calming and soothing and relaxing for children. Next slide. Talked a lot about mindfulness, and honestly, we could have a workshop, all of it in itself, about mindfulness, because it takes a lot of practice and a lot of awareness. But just, you know, very simple things that you can do is just going on a mindful walk. Really, when you walk outside with your children, what is it that you see? What colors, what plants, what are we smelling? And just really being aware of the surroundings and nature and noises and what's going on is just really significant. Again, a way to kind of get out of our negative thinking, out of our negative mood, out of our headspace, and bring it outside. Mindful snacking even, so taking like a tangerine or an orange and really taking the time to encourage your children to enjoy the texture of it, temperature, the taste, are all things that are really significant. And I know a lot of times we might be quick to eat or quick to do things, but slowing down and really taking the time are things that are going to help our children so much with being able to be calm and be relaxed. And gratitude, I can't say enough of, the science says that the act of being able to be grateful for something, the act of demonstrating gratitude are things that are just so helpful in so many aspects as far as their social emotional relationships, but also just how they themselves feel internally. So it's kind of that mindset of, are we going to look at the glass half empty or half full? And so looking at things half full and being optimistic, and really looking, yes, we might be limited with what we can do, and no, we can't do that, but then there's other opportunities, right? And so these are things that we can work on. And, definitely maybe taking some appreciation for our essential workers. It is a very stressful time, but there is a lot of people working together to help make the community safe, help make our children safe. And so really taking the time to honor and appreciate that are very significant for our children and for ourselves. Next slide. So there's so many different ideas and information. Every day I get hundreds and hundreds of emails. And so technology is on top of this. The state, it's one of their initiatives is to promote that mental health, well-being, the wellness, and really support children and students in their social emotional development. So if you go to our district website, you're going to see the logo, the distance education. You click on that. And from there, there's so many different resources and information. But if you click on social emotional resources, there specifically, you will see information on how to access mental health emergency services. So if someone is in danger of harming themselves or others, or suicide or psychiatric emergency, there's a hotline. There's support 24 hours a day, 7 days a week. But there's also resources and information on if you're just feeling overwhelmed or upset or sad and you want to talk to someone. They have what they call a warm line, or someone will be there to listen and help you through that situation. And so there is an array of services and resources, even when we were more restrictive and there was less things that were open. These services continue to be available to the community because they are so essential and critical. Other resources that are on the website is how to talk to children about COVID-19. There's actual scripts, words, and again, it talks about, how do you talk to a preschooler, how do you talk to a teenager, how do you talk to an third grader or a fourth grader. So again, something very specific to where they are developmentally and what words or scripts that you can use. There's also strategies just as a family, like how to set schedules, just to help things run a little bit smoother with being at home. And then there's information on emotional health and just nutrition and things that are just gonna help with that, just wellness and health. And then there's very specific information on the coping skills, more ideas, the deep breathing, the relaxation. When we're feeling overly nervous, what can our kids do? What can we do for ourselves? And then there's even actual lessons or activities to go over that social emotional, things like gratitude and compassion. How can we teach that at home? So there is so much information out there. And we try to organize that for you. And this is something that will be evolving. We're getting so much information, and so information will be added to it as well. Next slide. And then also, our parent and student engagement department, we're very much a priority to be a resource, to be assistance for students and for parents and for families. And so the resource center is open. The resource center, we are tasked with helping parents help connect with resources, with assistance in the community. So you're welcome to call, schedule an appointment, and just get information on a number of resources, whether it's medical, mental health, trying to get counseling for yourself, for children, for family, legal resources or assistance. We help make that connection and give information. Next slide. So I did share a lot of information and talked a lot about different things, but I thought that maybe I can get an opportunity to hear a little bit from you. So if you feel comfortable, you can unmute yourself and maybe share something that's resonated with you or something that stood out to you in one of the things that we talked about. Or if you feel comfortable, you can type it into the chat. But we would love to hear from you. This is really for you and about you, and we want to make sure that what we're saying is something that might be meaningful, or just kind of see what your take on the information we shared on today.
And I see on the chats, Miss Melina Ho, thanks for sharing the info about Common Sense Media, about the books to inspire kids to be grateful, build self-esteem and empathy and character development, strengths, and life skills. Yes, there are lots of resources out there. And sometimes it's a matter of time and balancing our lives so that we can take the time to look at the resources that are available for us. And then Ms. Anderson, hey, great to see you. Thank you for the info. I will check the book recommendations too. That's perfect. If there's anything that you would like to learn more about, please let us know that as well. It can be via chat or email us. And we want to schedule another wellness workshop for our parents, probably in the next 2 weeks. And so if there's something that you are interested in learning more about, then please share with us, and we want to design our workshops for what you're interested in learning.
And thank you again for the time. We really value your time and appreciate that you're here joining us. And now more than ever, definitely the partnership is very critical. You're welcoming, literally the school into your homes. And so we very much value and appreciate that.
Anything else? And these are the additional references, and they are direct links. So when we put them on the website, you will be able to click and get to them directly. Was that the end?
And then a lot of this information did come from newsletters or parent tips. So if it's something that you found interesting, UCLA Health and Chalk, you can sign up for that newsletter and get that information as well.
Okay, so we want to thank everybody for joining us once again. Thank you for spending an hour with us. If you are interested in anything for the future, we will leave the chat open for just a few more minutes. And you can always contact us via email or call us. We're here for you, to support you and to engage with you. So we'll do that. If you have any questions, we'll hang out for a little bit as well.
And then I will also put my direct contact information if you wanted to reach out to me and have specific questions. That will be available as well.